Today is the day. Medicaid expansion starts in North Carolina. This is going to affect thousands across the state. But we're talking about that, and we're also talking about how the Medicare enrollment is on right now. The Affordable Care Act re-enrollment is on right now. Both of them have fast approaching deadlines. So we have experts for you to help you with each one of these. Catherine CVA with AARP, Steve Edmonds with Alliance Insurance Services, and Laura Packard from Healthcare Voices. They're all here to help you navigate all of the tricky processes of health insurance and to make it seem like you know what's going on, because they're going to answer your question. What we want you to do is get your question to our experts. 336-379-5775. Remember, all your questions are anonymous, but they are answered in real time. So we don't want you to hesitate to ask the question. Ask it so you know what's going to be going on. All right, first and foremost, Laura, let's talk about it. Medicaid expansion today. Who qualifies? What do they need to do?
Well, the first thing you should do if you think you might, or even if you just want to find out more about what this means, is go to medicaid.nc.gov, which is the state administered website. It explains who is eligible and how you sign up. And if you don't have access to the web, even through a library or something like that, you can also call or go to your local Department of Social Services office, but they are probably slammed. So the fastest way to find out if you're eligible and start the process is probably going to the website if you can. And again, that's medicaid.nc.gov.
That's right. Okay, medicaid.nc.gov. We had like a kind of a background there that just said medicaid.gov, but that's like for all national. Now that it's expanded here, we want to make sure that you get that specific information. All right, Catherine, let's talk about Medicare, which is totally different, and the enrollment's going on.
So just to remind you, Medicare is the medical insurance for people of retirement age. 65 is your date unless you have a disability. We are in open season, which lasts until next Friday, December the 7th. And so you have between now and then to look at your existing policies, particularly your supplemental and your drug policies, and make changes. This is the one time a year that you can make those changes.
Okay, and right now we've got a thing on the screen so everybody knows that when you are 65, you have the 3 months before and the 3 months after to enroll in Medicare, but that is not your time right now.
Right, for your first signing on, your birthday trumps anything else. You need to watch that birthday 3 months before, 3 months after, or the month of. This is for making changes in your Medicare, many metas in your Medicare program.
That's already enrolled. Okay. All right, now let's go to the third enrollment that is going on right now. Steve, you've got information on that. That's the ACA Marketplace enrollment.
Yes, a lot of people are on ACA Marketplace plans. Some people call this Obamacare. And there are 2 dates to remember as far as signups for 2024. So December 15th will be the first deadline. So if you want coverage by January 1, you need to call and update your plan by December 15th. The second deadline will be January 15th. So if you wanted to wait or things got really hectic and you've just not had time to do it, you can still update your plan by January 15th, but just remember your effective date will not be until February 1. So that's very important. One other thing I will add to that is if you don't update your plan at all, if you've had coverage and you've been getting coverage in 2023 and you don't do any updates, your plan should automatically renew for 2024. It's always better to update these plans because things can change, like your income or the networks with the plans. I always like to do homework and be proactive in enrolling those for the new year. But if you don't, your plan should roll over and automatically renew for 2024 in one form or another. It may not be like you want it, but it should enroll.
Right, which is why everybody should be taking a look at everything. That is ACA enrollment and Medicare as well. Okay, we're doing all 3 today, so whatever your question is. When it comes to Medicaid expanding, Laura, because it is brand new starting today, we're guessing that there's going to be all kinds of scams and things, people trying to tell people that they need to sign up in a certain way that's not true?
So again, start at medicaid.nc.gov to get reliable information from the state of North Carolina. If you get a phone call, make sure you know who you're talking to, and you may want to get a phone number and follow up rather than signing up for anything over the phone without, make sure that the people you're giving your information to are legitimately part of state government and they're there to help you, rather than they could be trying to sell some kind of insurance policy that is not actually Medicaid and would cost you more money.
Okay, and I think that a lot of people are asking that, like, how much does Medicaid actually cost me?
It depends on your income level, but it should be very affordable to maybe even free.
Okay, gotcha. All right. And when we're talking about Medicare, Catherine, people are asking, is it better to be on traditional Medicare or Medicare Advantage? Can you at least, let's talk about what Medicare regular is and what Medicare Advantage does.
So that's a personal choice, really, as far as which plan you choose. Original Medicare is a plan that pays for different segments of care. Part A pays for hospital care. Part B is physicians care and things like physical therapy. And then you have to buy a companion plan to have your pharmaceuticals covered, which is Part D. The difference in that and Medicare Advantage is a bundled program where all of that's bundled together, and there are sometimes additional services with that, like eye care and hearing aids, those kinds of things. But in those plans, you may well be restricted to physicians within that network. So you may lose some of your freedom of choice.
Gotcha. Okay. So there's always kind of like a trade-off there of what that is. All right. And that's why we have our experts here today to help you navigate that. So whatever your question is, 336-379-5775. We're going to take a quick break. We'll be taking your questions when we come back.